This next exercise is called straight leg openings. It's all about pelvic stability, so using those core abdominals primarily to prevent any pelvic rotation or any arching of that lower back. So we're going to be lying on the back with one leg stretched out along the floor, arms are down by the side, and we're going to lift the other leg up in the air. So bend the knee and then stretch the legs. For tight hamstrings, they might have to bend that knee a little. Okay, that's absolutely fine. Or you might just have the leg a little bit further away from that midline, bearing in mind the further away the leg is, the more likely the back is to arch. Ideal position, knee above the hip at 90 degrees. But to bend that knee, to get it above the hip is absolutely fine. So from here, I'm just going to get to bend the elbows and place the fingertips on those hip bones, because we're only going to take this leg out to the side as far as the hip bones can stay level, because what wants to happen is this hip will want to lift away from the floor, and then we've got this rotation of the pelvis. So as I push my leg out to the right, I'm going to press my left hip, my left butt cheek into the mat, and I'm only going to take that leg as far as I can keep those hip bones level. So you're going to exhale, inhale, hold, and exhale, coming back to the center. To make it easier, I can bend the knee. I shorten the lever. The movement is the same. I exhale, open out, breathe into hold, and exhale, coming back to the center. So the primary purpose is to prevent pelvic rotation. So I need to use my oblique muscles and the core muscles to keep that hip pressing down. Okay, Jasmine? And what I want you to do, Jasmine, just before you lie down, I'm going to get you to lie with your head here and your legs here, so we can get a view of the leg, how far it opens out to the side. So it's straighten one leg. That's it. And arms are down by the side. So we're going to lift that leg up in the air. And I'm going to stretch it up. Okay. So making sure that the waist is long on this side, so we're not hip hitching and shortening in that side of the waist, lengthening it. And if we need to bend the knee to do that, that's absolutely fine. And I'm just going to place the fingertips on those hip bones, making sure that they're level, the spirit level is there, there's no rotation. Breathing in to prepare. As you exhale, engage pelvic floor, belly button. Just take that leg out to the side and really focus on pressing this hip down. That's enough. And gently coming back. Breathing in. Exhale. Just to there, keeping that waist nice and long and gently coming back in. Now I'm trying to do it with the eyes closed. When the eyes are closed, we can often home in more on our internal environment. We're more sensitive to different sensations within the body, different changes in pressure. When we cut out that external view with a tendency to look around the room. So we can often concentrate much more. Just to there, Jasmine, lovely. And then gently back in. Let's try it with that knee bent. Breathing in to prepare. Deliberately pressing the opposite hip down, the opposite butt cheek down. Nice, and those ribs nice and tight. Gently back. Good, one more time. Breathe in to prepare. Exhale, engage core. Push it out only as far as you can keep the spirit level. Hold it, breathe in. And exhale, slowly coming back. Beautiful, and then stretch that leg down. And then you'd start and repeat with the opposite leg.